With a focus on advancing emergency care, Zoll delivers innovative, user-friendly technology designed for where and how you work, and for the patients who rely on the care you provide. Zoll is committed to helping you save more lives.
Please welcome her. Thanks. Good afternoon, ladies and gentlemen. Thank you for staying on, and I know it's about lunchtime, so I do appreciate if you can spare me some of your time and be with me. Of course, my name is Zeenat. So basically, I'm currently with Liddell, and I'm their education service specialist. And a little bit more about myself. Previously, I was a paramedic with SCDF for the past 14 years. So being a paramedic, we turn out for all cases, all emergency cases, so emergency medicine is very close to my heart. I remember as a paramedic, I have to go out and handle all kinds of cases, and I remember one particular case where me and my crew, basically it's a crew leader, the medic, and driver. We had to go to Tuas and receive a case, and when I was there, 3 Indian nationals, who were all very young, came to me, all collapsed. And my training that I received from SCDF gave me the courage and competence level to handle when we are faced with such cases. Okay, basically my talk today is low-dose, high-frequency training. So the reason why I shared with you my experience in SCDF is because of the kind of training we receive. It's not like a 1-month training. It's actually broken down over 2 years. And we have attachments, we have frequent trainings, we have frequent reassessment to make sure that we are competent enough to handle such cases. And this is what I'm going to share with you. The various studies that has been done to show that low-dose, high-frequency training is effective. Okay, Liddell is, I'm sure all of you all know Liddell, right? Okay, our strategy is basically to save another more than 500,000 lives by 2020. Additional. Okay, we have this motto in our company. And basically, how training is conducted now is high-dose, low-frequency kind of training. And we want to shift this to a low-dose, high-frequency kind of learning. Because I remember, when after my SCDF, I was with International SOS for 4 years. Okay, and I was actually deployed to work on a rig. And to go on a rig, you need ACLS. So ACLS is a 2-day course where I remember being bombarded with all the medical and all the medicine, and because I was a paramedic. So the drugs were pretty new to me. So I still managed to get that cert. And that allowed me to go on a rig. But I realized that after 6 months, because I don't practice, I don't practice. So once you lose your practice, you tend to forget. There was no booster training, So when you forget what you have learned, are you competent enough to actually carry out? No, I don't have the confidence level. And I wouldn't want to do my ACLS on a patient because I don't have confidence, I have no practice, I lose touch. And that is within 6 months. So the decay the skills decay is actually, it is shown here in this diagram. When I go for my recertification for my BLS, okay, I talk to people. So the participants actually share with me that I asked them, so have you done CPR on a patient? Or how confident are you if you have a collapsed patient in front of you? They said, no, I wouldn't do it because this is my first time, and even though I have the cert, I don't dare to actually do it because I forgot how to do it. So I'm trying to show here is that this is, you go for your certification, and in between, what are you doing to actually boost up your confidence level, your skills? Especially for healthcare workers, everybody needs to have the cert. So when they are really into that situation, somebody collapses and they have to approach how confident they are and how good their skills are to actually do CPR. So just imagine if they have continuous practice, okay, and they maintain their competency. Can you see that the decay is very little? They have more confidence to actually do CPR on a patient rather than take a step back and let the other people do it. Okay, low dose, high frequency has yielded very favorable results in both education settings and with healthcare providers. Okay, there is a few studies that has been done. This is an example, rolling refresher, a novel approach maintaining CPR skill competence. Okay, who were involved in this? PICU nurses, the staff. What they did was they had two groups. One group practiced 2 or more times of CPR, and the other group were actually less than 2 times a month. So guess who scored better? So basically those who did more than 2 times a month, they actually maintained the level of competency. Okay, another trial that was done, a randomized controlled trial of in situ paramedic ALS recertification. There were 2 groups, also PICU registered nurses, therapists, and nurses. One group, they had the AHA Pulse recertification course. That was a 1-day course. They had to go through it. And another group, okay, the content of the course was actually broken down and reconstructed into 6 shorter sessions conducted monthly in the in situ. And the result, the latter significantly improved PICU nurses and respiratory care performance in resuscitation clinic skills compared to the current 1-day pulse recertification course. So again, it's a low dose, high frequency. If, let's say, we break down the training materials and spread them out, the providers will be able to retain their skills better. This is another trial that was done. This is a 2-minute training for improving neonatal bag and mask ventilation. This was done in the Netherlands. So the objective is to test effectivity of 2-minute training consisting of few key points in ventilating. Okay, so they took experienced and inexperienced caregivers and they were asked to basically ventilate. And they actually measured if there was a leak and how skillful they were in actually ventilating. So basically the conclusion was that a 2-minute training of bag and mask ventilation was effective. So continuous training to ensure that the providers retain their skills instead of a long break, and then when they are faced with the situation, then they have to do it. There is, their skills is actually reduced. Okay, this is a very nice example, another example of low dose, high frequency simulation training, reduces early neonatal mortality. This was done in one of the third world countries, Tanzania. It was the first country to pilot test this national implementation of simple simulation-based training in neonatal care and resuscitation, and the hospitals chosen was Haydam Hospital. So it was identified that in this region, the midwives actually lack a lot of knowledge and the skills, confidence level, equipment, and of course being a third world country, it was identified that that the resources available is quite limited. So basically, 9,000 newborn die each day globally. So we're trying to understand that, and they actually defined the goals. So they identified that they had to enhance the skill of birth attendants. Okay, to reduce the neonatal rate, mortality by 50%, and to reduce the number of fresh stillbirths by 25%. So they actually came up with this, and to reach out to their goals, they came up with this chart so that the midwives can follow the chart easily, what to do if, let's say, the baby comes out and the baby is not breathing. So this project is actually called Helping Babies Breathe. So it was a one-day course given to the birth attendants. But, you know, like just a one-day course was actually not enough to change their clinical practice. And they were basically doing the same thing when they had a case. So basically, it didn't reduce the mortality. So we taught them a one-day course. And when they went back to the ward or clinical practice, it actually didn't help in the mortality rate. It was still the same. So how were they going to solve this? They actually implemented the low-dose, high-frequency in-situ training, whereby every week they had a training in the labor ward supported by the local leaders. And when they observed the performance and the perinatal outcome actually improved, and it decreased the mortality rate by at least 40%. So these are the babies. So it's actually proven, and it's actually proven that basically basic and frequent simulation training change provider performance in the delivery room and save newborn lives. These are the various studies that has been conducted for low-dose, high-frequency kind of training. Now, the question here is that maintenance of competency. Yes, acquired competency and skills will decay over time if not maintained. I have experienced that myself. This rapidly becomes a matter of patient safety and undesired deterioration in patient outcomes. But the main thing is that as an organization, ways of maintaining competence, once acquired, is both an education and organization challenge. It is a huge challenge because we have to think about manpower. How often are we going out to train? So it is definitely a huge challenge and need efficient education paired with a local implemented plan to succeed. So it takes a lot of work to really create a workable plan. But in the end, who's going to benefit? Who's going to benefit? Patient. Yes, correct. In the end, basically, we're doing all this for patients. So summary is, I really hope that the way that we are doing training, we can re-emphasize and do more frequent trainings, because in the end, it's going to build up the caregivers' competence, their skills. They're going to maintain the skills, and they're just going to be confident doing what they do. Thank you.
Thank you very much. Any questions? Please raise your hand.